you're in the medical bookstore
Right.
for
12
medical
years? It's been
students.
like 12 years ago.
Yeah. And they're giving out texts instead of texts like the Guyton textbook, which is the kind of the hallmark classic for the last, several decades of education. They're giving out pamphlet Reader Digest, you know, mini versions of for doctors to learn it.
Right.
Okay. I just wanted to make sure I heard that right.
Yeah. And they don't take biochemistry anymore, and their pharmacology. So going back to some of the natural things, I don't have it with me, but I have a PDR. It was a physician desk reference from 1979. And I got out of school in 1981. I never worried about giving something to somebody and then, getting sick from the medicine, except for chemo. We knew chemo would make people sick back then. But other than, and I didn't give chemo out because I wasn't that type of pharmacist. But the thing was, we never, even though they say digitalis is poison, it's from a plant. It is poisonous, but it's really a homeopathic dose. It's such a tiny dose when they use those poisons like that you'd really have to take probably a bottle full to really get ill from it. But anyway, we never ever worried about that whatsoever. And I had one of my students go through and put a little post-it note with every prescription digestive enzyme. There's probably 20 of them back in 1979, and I think there's 12 pharmaceutical companies that made those. And why? Well, there was about 50 studies that show as you age, you lose your digestive enzymes, capability of making digestive enzymes. So when you take a digestive enzyme, it will help digest your food. And so you're not Prilosec deficient, you're deficient in digestive enzymes. Cholesterol, when I got out of school, was 270. We didn't worry about that very much and didn't even really learn that much about it until the drugs that are very expensive came around. But when we did treat it, we treated it with bile salts. And I still use bile salts to if people need to lower their cholesterol. And it still works, just like it did 40 years ago. It still works. The other thing that with the bile salts, it was standard of care for people to get bile salts when they had their gallbladder removed. And if there's anybody out there that has removed their gallbladder, if you take bile salts with your meals, it's going to be a game changer for your life. And interesting, in my naturopathic course, I learned that it helps make a taurine that facilitates dopamine. And so I thought to myself, I wonder if that causes Parkinson, because that's a disease of low dopamine. And we have a big group, about 100 patients of Parkinson that our psychology department has. And every year they ask me to speak to them once a year. And so I said, I can't really ask you because of HIPAA, but I really wonder how many people who had lost their gallbladder got Parkinson. Well, I had about 6 men come up after the talk and say, I didn't get one Parkinson's symptom until I lost my gallbladder. So when I hear things like that, so we took all these wonderful courses. And then our last year at Medical College of Georgia, we were with patients in the hospital with the medical students and the doctors. That's what we did for a year. And I remember we had a case of pancreatic cancer back then, and they're like, oh my God, we've never seen this before. And they said, okay, every medical student and me go to the medical library. And back then you actually had to go. We didn't have computers. You had to go to the little card catalog, find the journal, because maybe we missed something. Maybe there's a new treatment that we don't know about that we can help this patient with. That's what I did when COVID hit. I remembered my grandmother telling me, my grandmother had a 150-acre farm and never took a drug. And I remember her telling me that we were by her elderberry trees, and she said that she had treated 20 people with this really bad flu. She was talking about the Spanish flu. And she was in Western New York, southern Western New York, near the Finger Lakes. And she said none of them died. And then that our family took it as a preventative, and we didn't, nobody got sick on our family. Now, my great grandmother, who had just come from Italy a few years before, who lived in Buffalo, only like 40 or 50 miles away from my grandmother, my other grandmother, she died of the Spanish flu, and it really was devastating for that side of the family. My grandfather actually had to go into a Catholic boys' home. God bless his soul for that. So these diseases really cause devastating effects. But I learned from my grandmother on the farm really what healthy was, because she was incredibly healthy. And she did everything we're supposed to do. She drank well water. They would hunt. She would can deer meat for the winter. So had wild turkeys. She killed her own chickens, and she really had an organic lifestyle. My grandmother didn't even have electricity, and my father was the head electrical engineer for Motorola. And I remember as a little girl, he was so excited. He'd gotten a team of people together and said to my grandmother, next weekend, we're going to come put electricity in. And she goes, absolutely not. That disturbs the electrical current in my body. I don't want it. And, I was on for several years the board of the American Academy of Environmental Medicine, and we see patients if their electrical boxes are near their beds, or even people have to actually move to West Virginia because Wi-Fi can cause. We saw a case of someone that looked like they had Parkinson or MS, and it was all 100% due to the Wi-Fi. Her shaking and everything totally stopped when they put her in a room where there was no Wi-Fi. So my grandmother knew all that back. She was born in 1900, so a long time ago.
Yeah, a lot of change in the last 100 years, just
Yeah,
radical chemical
terrible.
exposures,
Yeah.
electrical exposures, EMFs. So let's go back to, you were saying, your understanding of what they were learning in medical school was being basically condensed into like a Reader's Digest version. Um, do you have other examples of that? I mean, that was 12 years ago. What are you seeing today? Because I know
Well,
you're involved in academia.
so there's no so, I always say, sometimes I talk at conferences, this book, our medical physiology, which was my favorite, it made me very good at what I do today, because when I walked in pharmacy school, they said, and we had 3.5 averages in calculus and physics. So, a third of you'll flunk out. Look to the left, look to the right. A third of you'll be flunked out. And we're like, well, excuse me, we had to have a 3.5 in calculus and physics and biochemistry to get in here. And sure enough, a third flunked out. And it was from my medical physiology professor, who would ask a question like, if you have Addison, which means low adrenal output, your adrenals are weak, what happens to the QRS wave in the heart? So she connected the whole body together, and every question was like that, where you learn that the body is so logical and it has such common sense. And what they're teaching is so non-common sense and ridiculous. So I don't think they want them to learn the real science of what's going on. And what they'll say is, oh, they took physiology undergrad. That's what they'll say. But they didn't have Becky Bunce
Yeah.
asking very, very difficult questions. So you really understood the hierarchy and how that body worked. So we had a pharmacology book that was thicker than the Guyton book, called Goodman and Gilman. And in that book, they had things like poisons and something called chelation, when you get too many heavy metals. 200 pages of that book, and little tiny writing in these books too. They're big, but they're tiny, tiny writing. And they talk about different types of metabolites of the vitamins and all sorts of things in that book. And today's medical students, they get none of it. That took a year, that course. Now they get 6 weeks. And it's basically if somebody has a strep throat, first give them amoxicillin with clavonate, and second, give them Z-Pak. If that doesn't work, send them to a different specialist and get them off your hands, because that's what happens. You go from they learn nothing, and you go to place, and they keep testing because they got to do something. And, that they don't resolve many things. And the problem is a lot of people in public that if I am at a conference or my patients, they'll start blaming the doctors. Well, those medical students come to me and say, Dr. Lafferty, I just spent $1 million and 22 years of studying day and night of my life, and I don't know anything. Or I worked with the psychiatric residents once, that they're already physicians, and then they go do residency in the psychiatric hospital connected to another hospital. And I was doing a mindfulness. So I started off by asking them, what do you think about when you come in here? How do you feel? And the first one says, I think I'm going to kill somebody with these drugs. And the next one, I think I'm going to kill somebody with these drugs. So imagine you spent all this time, and their hearts, not, there's a few of them went in it for the money and the prestige, of course, they're big egos, but most of them, you don't work that hard and not have a passion inside of yourself to help people. They want to help people. They just don't know how. And a lot of times when you go into the doctor's office, they'll be very mean because, oh, okay, you took this digestive enzyme and all your problems are all right. Well, I've got nothing for you. Get out of here. Or I had her father was a doctor at Harvard, and she's a brilliant lawyer from, I think, an Ivy League school, and spoke perfect Chinese. And I tell you that because she lived in China for 12 or 15 years, putting all the contracts together for McDonald's when they were putting their McDonald's across China in the early 2000s. And had lesions all over her arms. Her period wouldn't stop for 5 years, and she could hardly defecate or poop, like once every 2 weeks, even with all these meds they had her on. And she went to Harvard told her, if you don't take these drugs, we can't do anything for you. And all they want to do is shut down your immune system. But there's a reason why the immune system is working. And then she went to an infectious disease doctor down here after going to about 20 dermatologists, and they kept trying to biopsy the lesions. And well, there's nothing in those lesions. The first thing I ask her, because when I see patients like that, the first thing I ask, and they always say yes, do you travel a lot to the third world? One of our employees, he was the pianist for the UN, and he would travel to 125 countries a year. So he was so he had these types of lesions on him as well. And she said, you're the first person after like 10 years of trying to find help. And anyway, when she went to the infectious disease doctor, he said, you know what? You need to go see a psychiatrist. And she's like, you're telling me that these lesions, and I've had my period for 5 years straight, this is all in my head? And yeah, it's all in your head. Well, it took the pharmacy students going on Google, looking at those lesions to figure out she had schistosomiasis, which is endemic in China. So no one ever asked her, did she live someplace else or visit a lot? Like, there's no curiosity at all. It's just dismiss. And this ego attitude of, well, if I don't know it, how's a chiropractor or a pharmacist going to know those things, or, whatever. So you have this unreasonable ego with a lot of the doctors. And I think they're just trying to protect themselves from experience every day having no information.